Chapter 7, Positive and Negative Event Queries. This chapter is based on learning how to identify positive event queries and negative event queries while taking the NCLEX. Some positive event queries would have keywords. For example, you may see early or initial, and sometimes select all that apply. An example of a positive event query sentence would read, a client with suspected active lung tuberculosis is being scheduled for diagnostic test. The nurse anticipates that which diagnostic test will most likely be prescribed to confirm the diagnosis. Number 1, a chest x-ray. Number 2, skin testing. Number 3, sputum culture. Or number 4, white blood cell count. Now think about it for a moment. Being that the patient has a suspicion of active tuberculosis, the most important thing to do at this point would be number 3, a sputum culture. When looking at positive event queries, sometimes there may be a sentence when a word just pops out. For example, what is the earliest sign of change in a level of consciousness? If reading this sentence, then you would know the key word in this sentence is earliest. That would be your positive event query. There are also negative event queries while looking at the NCLEX. Some negative event queries are less likely and ineffective. These are words that you may see while reading sentences. So if you have a question with 2 or 3 answer choices, most likely 2 or 3 of them would be similar, and of course the other would be the most apparent. An example of a negative sentence would be, the nurse is reviewing a nursing care plan of a hospitalized client with sickle cell crisis. Which of the client's problems is the least priority? Number 1, generalized pain. Number 2, signs of dehydration. Number 3, inability to cope with the disease. Number 4, lack of perfusion to the peripheral tissues. Remember, this is a negative event query sentence. Therefore, the most prominent answer would be number 3, an inability to cope with the disease. Remember, when reading queries for the first time, whether it's positive or negative, try to locate keywords to assist in determining this. Most likely on the NCLEX, positive inquiries are more frequently used. So remember those keywords to make sure you select an option that is both positive and correct.